Hello, welcome to week 4 of your Spinal Decompression Rehabilitation Program. I'm Dr. Andy Fetterman with RebuildDoc.com. For this workout again today, we're only going to utilize a couple exercise bands. You're going to want to use which resistance is best for you. When first learning these maneuvers, use a lighter band, but as you get better to progress, use some of the heavier bands that have been provided in your program. Our first exercise we're going to do today is we're going to do a banded deadlift. To do so, we're going to grab the exercise band evenly in both hands. We're going to then step onto the band at about shoulder width apart, maybe a little bit less, and we're going to hold the bands and we're just going to stand straight up. Hands to the sides, gripping, and we're doing a deadlift. So as we can see, our hands are going to the sides as I move to the side here. To do this maneuver, my hips are moving back just like the squats from last week. First, and I'm lifting up. Fully extending and not bending my knees back, but in a straight line as we get to the top of the maneuver. Again, you want to make sure that hips are moving first, and we're squatting down into the position to deadlift as if we were lifting up a deadlift bar. We're going to do 10 reps of those as we go through that. Next, we're going to have one of our exercise bands is going to be connected to a banister or railing. And we want to have this one about between waist and chest height because we're going to be utilizing this for a few things here. So what I suggest you do is you take one hand, you grab the one that's furthest away from the contact point, and then wrap your other hand around here so we have a nice firm grip without having to utilize your grip to hold the band. We're going to then step out to where there is tension on the rubber band itself. And again, if it's not enough, either step further out or what you're going to do, use a thicker band. So now we're going to hold our core tight. We're going to have our feet about shoulder width apart, and we're going to slowly push out and pull back in. And what we're doing is allowing the band to try to turn you, but you don't want to let the band move you. You want to try to keep your core tight and neutral for your entire spine. It's called a neutral spine. In and out. We're going to go nice and slow as we can do this. You're going to do 5 to 10 reps of one way, and then you're going to switch to the other side and go with the other way because as you can see, this is pulling me to my left. I also want the band to pull me to my right as well. Our next maneuver we're going to do is with that same band, we're going to go ahead as we're switching hands back and forth. We can then do what's called a walkout. So we're going to start here and we're going to keep our core here and we're going to slowly sidestep across and then step back as we're doing this. Again, I'm not letting the band pull me. I'm trying to stay neutral spine facing forward the whole time. So this is working my core as we're doing this. Again, 5 to 10 and then switch sides will be easier for this one. Again, whichever hand is furthest away from the contact point of the rubber band, it's better to grab here and grab there so you can lock in without having to feel like you're utilizing your grip and your hands are getting tired from holding the rubber band. Our last one we're going to do is we're going to drop this down somewhere about knee level to your body, anywhere from ankle to knee. Make sure it's pulled tight, and you're going to use that same grip, and you're going to take the band from the hip, and you're going to lift up across your body. Now again, what we're trying to do is hold our core tight. We're not trying to rotate. If there's any rotation, it should come from the hips, not from the spine or the back. We're here lifting up, coming across our body. It's called a wood chop as we're doing this maneuver. Again, we're going to switch, do it the other way for both sides, and you want to make sure that you're utilizing this evenly. Again, feet are about shoulder width apart. We're trying to keep our arms in not more of a locked out or fully extended position. We're starting here from the hip pocket, going right up across to full extension above our head. Okay? Last maneuver we're going to utilize, we're going to take the band. The way we're going to do this, you're going to take the band, you're going to go ahead and put it around your shoulders. So as you can see here, where the band is, it's catching my shoulders. I'm going to then stretch the band to my best of my ability, take one foot and step in here. I'm going to step here. I usually like to have the band going across the arch of my foot. As you can see with the band, it is now in this position. What we did last week is the squat. We're doing the same thing. We're going to make sure that we're moving with our hips back first and putting pressure on the outer part of our feet. The band is now giving us resistance. We're here and we're squatting. What I usually do is I hold onto the band loosely with my hands to make sure that the band stays in contact with me as much as possible. Again, vary which bands you want to use so you actually feel some resistance with this. Again, go down to where you feel comfortable. If there's any restrictions, that's fine. Make sure that we're focusing on the sequence of hips going back first and the knees pushing out with our feet about shoulder width apart as we're doing this maneuver. If you come with any issues or have any questions, feel free to reach out to us at relief@rebuilddoc.com. Enjoy the workout.